Hi, good afternoon again. Here we are again on this on another Tuesday afternoon, discussing another condition and some products here with PhytoQuant. And I'm Elizabeth Howard. I go by Liz. I'm the national educator and clinical consultant here with PhytoQuant and Steiner Labs. And today we're going to discuss bloating relief. So let's get started. So in today's discussion, we're going to chat about why bloating happens, what constitutes healthy digestion, and some ideas for relief of bloating. And then we're going to discuss 3 of our products that we highlight for bloating relief, and they are QuantiFlora, QuantiFeel, QuantiDigest. And then we're going to chat a little bit to answer your questions. So this is meant to be interactive to support you and answer the questions that you have. And then we'll talk a little bit more about aligning with PhytoQuant. So a little bit more about me. It's so great to be here. And basically, I began with Steiner Labs about 5 months ago, and I am their national educator and clinical consultant. I do have more than 15 years of experience in nutritional counseling, group and workshop production, and postdoctoral nutrition training. My previous career was in environmental compliance, and I used to like to marry the two, and now they're just basically morphed into one. And I really do specialize primarily, I was a bariatric nutritionist, as well as a nutritionist with gastroenterology doctors. And I specialize primarily in digestive wellness, which really does touch on a lot of different areas of health. And I also specialize in micronutritional supplementation and supporting practitioners and doctors. So let's discuss a little bit more about bloating causes. Gas, air, and medical conditions are the overarching causes behind many instances in bloating. So that's a good sign because, obviously there is a chance to intervene here with some integrative therapies. Gas and air are trapped due to the following types of habits: eating or drinking too fast, chewing gum, smoking, and wearing loose dentures or mouthpieces. Those are all reasons why air can get trapped and cause bloating. Other reasons why bloating might be an issue are medical or physiologically related, and those include IBS, IBD, other functional gastrointestinal disorders, heartburn and GERD, food intolerances, weight gain, hormonal fluxes, and parasites. Those are also some reasons. Remember that parasites are also going to affect gut microbiota, and all that eating and breakdown down there is going to create gases that can waft upward. Eating disorders, anorexia, or bulimia nervosa. So that's an interesting one to keep in mind. Mental health factors, and of course, some medications. So just to touch on some red flag conditions causing abdominal bloating, and just to mention here, of course, if you do feel that, or you do find that there are some serious red flags like the conditions below, it's a good idea to refer out to a medical doctor and just make sure, they have a lot of usually advanced testing, and it's a lot of times important for someone to get a specific diagnosis. But red flags are things that can cause abdominal and bloating, include things like ascites, which is fluid accumulation in the abdominal cavity. And that can be as a result of really serious conditions like congestive heart failure, liver disease, kidney failure, cancers. Other conditions which, are not necessarily life-threatening. Celiac disease is very serious, but celiac disease and gluten intolerance can cause bloating because of the lack of digestion that's occurring. There's such extensive damage down in the GI tract in those instances. Hypochlorhydria is actually very common. So nailing it down is, you could send somebody out to a medical doctor to have some testing run, but, there's a lot of questions that you can ask your client or patient that can hint at hypochlorhydria, including bloating, like for example, within 1 to 2 hours of eating, rather than within 2.5, 3, or 4 hours of eating. So immediate bloating is more of an indicator that there's probably a low stomach acid issue going on. There might be another physiological issue like a hiatal hernia, or it's good to ask the client or patient or find out whether or not they've had some type of invader like H. pylori, which is so common. So pancreatic insufficiency due to impaired digestion. Pancreatic insufficiency is now a new diagnosis, but it's important to mention that a lot of people can be suffering from dysregulated enzyme output due to just different issues going on through the digestive process. So, for example, low stomach acid, it might not be incredibly low, but lowered stomach acid can also impair the release of digestive enzymes because the barometer is not there for, the acid really isn't low enough for that barometer to go off and say, hey, you know, and tell the body to really release the pancreatic enzymes. So that can impair digestion. Also, if someone's diabetic and suffering from more sugar handling issues, the pancreas has already been affected with insulin dysregulation. And so it follows that the exocrine part of that organ and the release of digestive enzymes can be somewhat compromised. So that's an issue to just think about and work with in clinical practice. So perforation of the GI tract. Again, this is not leaky gut. Leaky gut is more of an issue with tight junctions releasing due to zonulin. And so those tight junctions usually go back together, but it's usually some kind of a dysregulation with the tight junctions where more molecules and particles than normal cross over the barrier there, causing an immune response. But in this instance, perforation of the GI tract with an actual perforation and the escape of gas and bacteria, et cetera, into the abdominal cavity is very serious, and it can result in like a septic type of issue. So these are, again, some possible things that we just went through that can be of a more serious nature, and it's a good idea to refer out to a medical doctor. So bloating relief, actually, these are some great, relatively simple lifestyle changes that you can suggest to clients and patients, asking them to modify the air trapping behaviors that they can really control. For example, you know, drinking from straws quickly, consumption of a lot of carbonated drinks, reducing the sodas, et cetera, and of course, reducing chewing gum. So those are some things to chat with your clients and patients about. Slowing down at meals, this is really a big deal. It can actually result in a lot of positive changes for an individual. You just have to help them with cues. So I've seen people where they put the knife, you know, maybe at a different location at the top of the plate, and that signifies to them when they sit down to remember to chew 36 times per bite, which really mixes the food with the saliva. And then, you know, usually people are not chewing or have as large of bites in the mouth. So that allows the food to be really adequately mechanically broken down and to start really good chemical digestion, and then the stomach can take it up from there. But that's a great thing to start with, and people see a lot of, I've had a lot of interesting changes reported with that, including weight loss, and additionally just repairing and restoring the lower GI, which is so tedious for a lot of people. So use lactose-free dairy products, address lactose intolerance. And, you know, a lot of your clients and patients are going to be lactose intolerant and lactose intolerant to some degree. So it's important, like with other FODMAP foods, to realize that the person may be able to eat some of them, excuse me, to an extent, but then beyond a certain serving size or portion size, they've overeaten that particular food, and now they're going to really struggle with digesting it. They just don't have the enzyme output. And that is so true with, of course, lactose, where the brush border enzymes for that particular disaccharide sugar just are not present in as high of amounts as they would be in someone who's younger. So someone who's relatively older is going to have fewer enzymes and someone younger would have more. And then of course you have people with inherited lactose intolerance. So avoid foods causing gas, such as vegetables in the cabbage family, dried beans and lentils. They obviously have some really great nutritional properties and they have some great resistant starches, etc. But these foods, a lot of them in the FODMAP family, can just cause a little bit more problems for people, that they ferment and they cause more gas. So it's just about what that particular individual is comfortable doing and what really is bothering them. So again, or probiotics, digestive enzymes, and other functional supportive supplements are really critical and very helpful here for potentially both the short term and the long term with some of your different clients and patients. So we do love to highlight the fact that PhytoQuant really is a different company that stands out, that is really gone above and beyond. And you know, these particular values that we are showing here are not trends, they are values that we've always been conducting business by, so they're nothing new for us. But transparency, which is such a big deal in our contemporary culture with companies, learning more about how things really are grown, you know, what is the process from farm to production, etc. And with PhytoQuant, we don't use any toxins, we just use spring water. We're using permaculture, planting farming, and we produce plant material in smaller batches and extract material that way. Ultrasound extraction is actually an excellent type of extraction that tends to really extract large amounts of the active plant, excuse me, and it's very, very effective. The importance of water, Grander method actually zeroes out the water, making it very, I don't know, kind of blank, and that helps with the ultrasound extraction process. And then quantum energy, we're using geobiology principles at our factory over in Italy. And as you can see here, there is a pyramid over the production process. And this particular facility is certified for exceptional environmental standards. Excuse me. Okay, so we have 15 exclusive digestive health products that we're very proud of. They're made in Italy, they're pesticide free, they're non-GMO, they're gluten-free, and they're very high potency. And although we have other products that we can pull through, as our particular brand is made in Europe, it is important to mention that all disease really does begin in the gut. So we feel it's a great place for most practitioners to be starting with gut health products. And of course, that phrase was coined by Hippocrates, the father of modern medicine. So bloating relief, here are 3 products that are real standouts in our line: QuantaFlora, QuantaFeel, and QuantaDigest. And we'll discuss those here now and their applications. And just to let you know, these statements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease. Steiner Labs cannot provide medical advice or guidance, and you should seek advice from a medical professional before making any diet or lifestyle changes. Excuse me. QuantaFlora, this is a synergistic blend of 4 strains of probiotics. And then we also add in FOS and inulin, which are of course prebiotics, and then coriander, which really makes this particular blend very unique, as it's very soothing and it helps people to accept the probiotics without any discomfort. So in this particular product, we're utilizing 4 strains of bacteria that basically some are present in the small intestine and some more so in the large intestine. And specifically, those are Lactobacillus acidophilus, Lactobacillus casei, Lactobacillus rhamnosus, Bifidobacterium longum. So some of the nice things about these, we're delivering 5 billion units to you, is that these particular strains do work on immunity, They really work to change the gut microflora balance so that immunity is raised. Specifically, they've been studied with bowel diseases, other autoimmune problems like rheumatoid arthritis, also IBS, bloating, which we're discussing today. So these particular bacteria really have research behind them. So QuantaFeel, this is a great, excellent product that we often see used in tandem as a companion product to QuantaFlor. And so it needs to be taken at a different time of day. So normally we recommend that practitioners consider suggesting this product in the evening time before bed. So 2 capsules with a glass of water. It contains magnesium, chlorophyll, minerals, micronutrients, and vitamins, and those are coming from stinging nettle leaf powder. So this has a pretty high amount of magnesium in it, and again, it has a high amount of chlorophyll, the chlorophyll acting to improve hygiene in the digestive tract. It's somewhat of an antiseptic. It has a slight laxative effect, so if you are dealing with constipation with a client or patient, this may be something you decide to recommend. And you know, this particular product helps to implant the good flora. So this may help with supporting the QuantaFlor. And so we do often suggest that people take this in the evening and take the QuantaFlor in the morning, either 2 cups before breakfast or 10 minutes after when the stomach acid is more dilute. QuantaDigest is a very synergistic and very, very interesting product. As many of you may know, fenugreek and psyllium are being studied more so in literature. Fenugreek is actually one of the newest and most interesting fibers out there that really does help to change the gut microbiome. At least that's what they're showing in literature. Psyllium is good for transit in the GI. Colostrum, it really does boost immunity. So this is a very, very interesting blend. Then you have caraway, yarrow, angelica. Angelica helps to raise pH. Caraway, yarrow are going to help to eliminate gas. Licorice is helpful for, has been studied for enhanced tissue repair down in the small intestine. And this particular product is highly recommended for heartburn and GERD by many practitioners. And the patient can, or the client can consider taking like 2 to 6 tabs. They're chewables. They can have them just before a meal, or they can take them even within a couple hours after a meal, and they're still going to have a very positive effect. So there's a good window there for taking this product. So they might start with 2 chewables before a meal. If they're having more discomfort, they could go up to 2 to 4 after the meal. And so we recommend around 2 to 6 at once, tops being about 6. So let's just chat a little bit about a possible person that could walk into your clinic. So this is a little hypothetical case study. And this is a 57-year-old woman. So this is based on some experience that I've had in clinic. This person has bowel movements that are difficult. They are hypothyroid, so they're tending more towards constipation, bloating after meals, reflux, and anxiety. So their diet consists of some refined carbohydrates, uncooked vegetables, bread, desserts daily, fruit drinks in the form of juice or bananas. So, well, they're maybe doing some fruit, but they're also doing fruit juice. She eats a large traditional breakfast at 9 a.m., eats a granola or yogurt snack with sweetener around 1 p.m. and then dinner between 5 to 7 and ice cream frequently as dessert. So definitely some refined carbohydrates, definitely some higher sugars in the diet, not all coming from just regular fruits or vegetables, but coming from some fruit juices. And there may be an issue here with uncooked vegetables, as people who suffer bloating or have problems with FODMAPs may find that those are difficult. Further symptoms include, again, we've touched on bloating, indigestion after meals, reflux, sense of excess fullness after meals. So that would be immediately, again, within 1 to 2 hours. Indigestion with fatty fried foods and dairy, sensitivities to FODMAP foods, and strong desire for sugar. Abdominal bloating, 1 to 2 hours, we already touched on that. Cramping in the lower abdomen, cravings for sugar, coffee in the afternoon, fatigue relieved by eating, followed by a crash, trouble sleeping, anxiety, panic attacks, headaches, and rash or dry skin. So again, this person probably is using caffeine to kind of stay awake and stay in the high pace of life. But just further analysis from a clinical perspective from me, the client has poor digestive capabilities. Specifically, she exhibits more than likely some type of lowered stomach acid. And then you want to get to the root of that problem. You know, does this person have a hiatal hernia? Is it just that overall poor digestion for some time has been a problem? You know, is it that they have H. pylori or have had H. pylori? So you want to get to the root of the lowered stomach acid. And then poor digestion of fats and fat-soluble vitamins due to large meals, inadequate bile output. You of course want to find out, does this person still have their gallbladder? That's a huge issue. Many people walking around out there do not. Digestive enzyme stress, probably lowered digestive enzyme output or lower presence of digestive enzymes down in the brush border of the small intestine. And then basically an overall reduction in the absorption or digestion of carbs, fats, and proteins. So she also does appear to suffer from sugar handling management issues with the fact that she's craving sugars a lot. And that can sometimes be, you know, you're craving the foods that you're addicted to, you're kind of feeding any kind of dysbiosis. And then, you know, you need sugar or you need caffeine to stay awake, but then inevitably she's crashing later. So these are all indicative of this person needs to eat better, probably eat smaller, more frequent meals. So FODMAP foods also do appear to be a problem. So just some recommendations to think about with this type of client or patient. Introduce the client to a high balanced, nutrient dense diet with 3 small meals daily and 1 to 2 small snacks. I definitely get people that do well eventually on 3 meals a day. But in this particular instance, to get this person regulated with her blood sugar management, you know, eating every 2.5 to 3 hours is a good idea. So change her fruit intake to fruits rather than fruit juices. If she can do whole fruits, fine. If fruit feels bothersome, like she's unable to do it, she can start by decreasing the amount of fruit, like a 1/2 cup of berries or so, and then potentially cooking fruits that can also help with digestion of fruit. And then cooking vegetables that helps to make them more tolerable. So I like to consider with a lot of people, especially people who appear to have a lot of symptoms of food sensitivities or intolerances, to really consider some type of comprehensive elimination diet for 2 to 3 weeks and add foods back slowly. It did appear that this individual was also having problems with dairy, so that should be part of the elimination program. And then that person can look at portion amounts of dairy when adding it back in. It may be fine for them to do, let's say, 1/2 cup of dairy, but you know, a whole cup of dairy beyond like maybe 6 ounces could be a real problem for them. And they need to accommodate, take digestive enzymes, do something else different. So celery or green juice first thing in the AM. I really like to suggest celery juice. It has a really alkalizing effect. So it helps the person to pull up their pH and absorb more nutrients. It also adds very critical salts, which help to improve hydrochloric acid output. So that's a very natural way to support your client or patient with potentially lowered hydrochloric acid in the stomach. So I really love juicing, and I think it's a great way to get people to absorb some foods, positively feed the microbiome for first food in the morning, and then go from there. Have them an hour later look at intaking some food. So supplementation for this individual, I would go slowly with this person. She's older, I mean, on the, you know, she's in her 50s, but I just wouldn't go really fast. So have her help her to shift the microbiome so it can digest more foods. It provides her more immunity, etc. It'll start to help to curb the sugar handling problem. So 2 Quantiflor before a meal in the morning, or 2 right, 10 minutes after breakfast. 2 to 6 Quantidigest with meals or after. You can take them before or after, some before, some after. 1 to 2 Quantifeel just before bed. So again, this will help to really implant good bacteria, decrease some of that bloating, also address the reflux with the Quantidigest especially. And again, with some of her dietary changes, this is a really great start. This person should really start to feel better pretty soon. But you're going to have to really address some of those individual foods that and tease them out and find out what's really, really bothering her. So customer reviews, Quantidigest, what an efficient product. Good for my son who suffers from intestinal reflux. Another review on Quantifeel, really cleans you out. Nathaniel Thompson, my mom sent this to me at college and I can't believe how much better I feel. I take 2 at night and have for about a month. So Quantiflor has changed my life, says one client. I have had stomach problems most of my life. I have tried similar products, but they have not worked. And I suspect they did not contain what they said they contained. Since I've been taking Quantiflor, all of my lifelong stomach problems have gone away. I love this product. So that's an awesome testimonial right there. Great probiotic. I've been taking probiotics for many years. These are the best. They don't bother my stomach and I don't have any side effects. I'm in college, so keeping my immunity strong is a priority. Thumbs up. So we do have some great customer reviews coming in about these specific products. And we also have a practitioner review from one of our great practitioners up in New York City, New York. There are a lot of products on the market, but it's really hard to find ones that are high quality, says Lauren Minchin. That's why I prefer PhytoQuant. So she was really looking for a reliable company, and she is a gut health specialist, and she really found that with us. So at this point, I'd love to open it for Q&A. I do think we have some of them written here in the box. So if you want to go ahead and shoot with a question, I'd love to hear them.
So Liz, this is Elizabeth. So one of the questions we got is, do you also suggest digestive enzymes for bloating?
So that's a great question. We were mentioning how, for example, our 57-year-old client that we did our case study on here just now probably didn't have enough digestive enzymes in the small intestine to adequately break down some of the sugars, some of the carbohydrates, and possibly other types of foods like proteins and or fats. And so yes, I do suggest digestive enzymes. You can do 1 or 2. We have a product called Quantazym. That's Quantazym, and I suggest that to a lot of clients. I have them do about 10 minutes, ideally 10 to 20 minutes before they eat. If you forget, or if they forget, they can take them with a meal. And I do feel that that provides a lot more digestion. A lot of people are suffering from you know, when you have really bloating people, I've seen people who really just were not digesting proteins and just really needed to reduce the higher protein foods in the diet, and then using digestive enzymes can really help to start cleaning things out as well. So better absorption with digestive enzymes, I definitely highly recommend them. Great question. Any other questions out there? Okay, thank you, Elizabeth. That was a great question.
Well, no, and Liz, I was going to tell everyone if they do want to ask a question, they have the ability to unmute themselves if anybody did want to ask something.
Great, thank you. So unmute yourselves. If you want to write a little bit about yourself as well, I forgot to mention at the beginning, but if you can tell us a little bit about your specialty and you want to unmute yourselves, that would be great. We really appreciate that. So I'll just wait and hang on. I'm going to hang on here. If you have a question, you're welcome to just interject and we will take your question here. Okay, so in aligning with FetoQuant, you guys, all of our wellness practitioners, are the backbone of our mission to transform the health of U.S. consumers. And with you, we really are able to empower a lot more individuals to take control of their health through micronutritional education. So, an extraordinary supplementation, of course. So, please do schedule your preliminary call to see if you qualify for free samples. You're welcome to reach out to me at my email address here, coming here at the end of the presentation. And Elizabeth and I normally will pop on a call with you and answer all of your questions, tell you more about our company's values. We can find out whether we align, and then we can go from there. We'll talk about samples too. So thank you so much for joining me today. I really enjoyed these sessions, and I am here to support you in your practice. Our complimentary discount code for today for your one-time purchase, so make sure you go up to fetoquantusa.com and grab all the products that you were interested in or that you're wanting to try. You can apply that Learn30 code to get your one-time 30% off discount. Then you can call us or email us and let us know that you'd like to do a support phone call, and we'll get on a support phone call and find out about more about you. So again, please schedule a time to speak with us further. If you had any questions too about this particular presentation, feel free to go ahead and contact me here at liz@steinerlab.com, and my telephone number is here as well. So join us again next week. Our next roundtable is going to be on sleep and relaxation. I'm here every Tuesday at 12 p.m. Eastern time. Grab another practitioner friend, and there likely is a benefit in there for you if you do that. And have them go up to our website and click Get Involved. So if there aren't any more questions, I had a great time today, and I look forward to speaking with and seeing everyone again next time. Thank you so much.